Tonight's big story, major surgeries are being cancelled at one of our biggest hospitals, driven by a combination of staff shortages, COVID and a surge in winter illnesses. Staff say this winter is the most challenging they've faced, and hospitals around the country could face a similar battle. Christchurch Hospital has more patients than it can handle. A 10% shortage in staffed beds has forced it to cancel major surgeries.
We don't take that decision lightly. We very much regret having to do that, as we do everything we can do.
So why couldn't they? Well, COVID is still rife, and now there's a rapid rise in other serious winter illnesses like influenza.
I absolutely have heard that from some anecdotal evidence that seems to have hit people harder than COVID has.
The number of patients turning up to the emergency department is also up, with 30% needing hospital admission. Too many patients and too few staff. There are 250 nurses short, with an average of 200 staff off sick every day.
I definitely think we're going to see a challenge this winter like we haven't faced for a wee bit.
A serious problem for Canterbury and a preview of what DHBs around the country could be facing. For more on this, I'm joined by Anne Daniels from the New Zealand Nurses Organisation. Thanks for coming on with us tonight, Anne. Cutting to the chase, I guess, are patients' lives at risk here?
Yes, they are. It's that simple. When you have a very tired workforce that doesn't meet the standards that are required to actually give safe care, mistakes will be made. The nurses and doctors and the healthcare professionals that do get to work when they're not ill have got huge workloads that they have to try and manage, and it's just impossible for them to actually provide a safe level of care.
Is the cancellation of these operations going to fix that, or you still think the standard of care is going to drop?
I think we need a lot more than that. We need to be innovative and creative, and we also need to start talking to each other. The nurse employers, the government, and the Nursing Council all need to get into a room and actually get a plan together. We're closing beds, certainly, but that's actually having a toll on patients who have been waiting for operations and treatment for very long periods of time. That's going to make them sicker, and that means that they're going to come into hospital and need more care than they should have had in the first place.
Okay, so we're talking about Canterbury here at the moment, but how do you see this playing out across the rest of our DHBs?
It's exactly the same. And some DHBs, it's worse. I heard today that Wellington has been having a terrible time of it, Waikato, and I know that in Dunedin it has just been rife. It's the same everywhere, and it's we need to actually do something about it, not just the quick fixes of closing the beds and putting off planned treatment. We need to do a lot more than that.
So how much of this is just down to not having enough nurses right across the system?
It's not just about not having enough nurses or doctors or other healthcare professionals. This is something that we've seen long decades ago that was going to come. We predicted it, and all the healthcare professionals plus the government and Nursing Council have been absolutely aware of this problem. But what we need to do is actually sit down and do something about it right now. We've been calling for change for a long time, but it has not happened.
Just quickly, we are just heading into winter. How do you see it playing out over the next couple of months?
It's going to get worse unless the public come on board with us and take the advice that healthcare professionals are giving, and that's prevention is the key. Hand washing, masks, flu vaccines, keeping your social distance, those are all important things. So if you're feeling unwell and you're not sure what to do, call your GP, call Healthline, talk to your Murray Health providers or your nurse practitioners and get some advice sooner rather than later, and as well as Healthline.
That is great advice. Thanks for your time tonight, Anne.
Thank you very much.